Hey everyone, today we're going to be talking about post-treatment skincare. This video is based on a question that one of my viewers asked in regards to using hydroquinone while she was doing laser treatment. And while she was doing that, she started to notice pigmentation formation. So here are the things that you can do to avoid such things. The three areas that you need to focus on is number one is wound healing. That is the stage immediately after the invasive treatment, whether it be laser, acid peels, microdermabrasion, microneedling, or even plastic surgery. So the longer the recovery time is, the more likely you can incur an infection, inflammation, pigmentation formation, as well as irregular striations of collagen and elastin, depending on the type of treatment that you're receiving. Number two is you want to keep that heat down on the skin, because the longer the time that you actually have prolonged heat, it can be an indication that you have inflammation. And we all know that the longer your skin is exposed to heat, whether it's external or internal, the more likelihood that you're going to start to form pigmentation later on after your treatment. And number three is really focus on increasing the hydration levels in your skin. So all of our cells are mostly made up of water, including skin cells. And so when you have dehydrated skin cells, the recovery time increases, and the more likely you are to have some post-inflammatory hyperpigmentation. This is why most post-recovery skincare treatments focus on reducing TUL, transepidermal water loss, because the more likely that you have that, the more likely your skin will peel, there'll be inflammation, and so you want to reduce that. So to answer one of my viewers' question, here's why I don't recommend using hydroquinone immediately after, or in her case, while she's using the laser treatments, because hydroquinone can slightly increase the inflammation in the skin. This is why when you start using hydroquinone on an acne scar or a wound, the pigmentation actually appears darker and it looks more red. And so it does increase inflammation. So especially while you're doing laser treatment or immediately after doing any type of invasive treatment, you don't want to increase the inflammation, because you've already voluntarily incurred inflammation on the skin. Number two is any type of tretinoin, like whether it's tretinoin, hydroquinone, corticosteroids, they can dry out the skin. So when you do, in this case, laser, you will notice that there'll be an increase of dryness of the skin, including post-peeling. For peels, so you're going to only increase dryness. And remember, I said one of the areas to focus on is increasing hydration. Number three is corticosteroids, tretinoin, or any type of retinoic acid, as well as hydroquinone, actually can increase photosensitivity of the skin. Now, photo means light. It's not just UV sensitivity. It's an increase to blue light, which you're being exposed to looking at your phone or your computer. It could be red and white light. It's all types of light. So even with post peels, microdermabrasion, microneedling, laser, they tell you to avoid UV light. Well, if you're going to do that and then put these topical medications, which also increase photosensitivity, this can increase pigmentation of your skin, and UV light can penetrate deeper into your skin because your skin is a bit thinner. So even though these widely prescribed topical medications are very commonly prescribed immediately after these type of invasive treatments, this is why it is very common for people to contact me 6 months to a year after these type of invasive treatments. They start to form pigmentation, because your skin, like any other organ, even though it's the largest one, will protect itself when exposed to heat, light, and inflammation during its most compromised stage. So don't use this immediately after. You want to wait when the inflammation is completely gone, the wounds are completely healed, and your skin is not sensitive at all. that's when you can introduce these type of treatments if you choose to do so. So for those of you who are new to my channel and watching this video and you're considering doing an invasive procedure, my name is Christy. I have been professionally treating clients with treatment-resistant hyperpigmentation, acne, and anti-aging for over 18 years and have just passed over 27,000 different treatments. And so because I have had experience in all different levels of hyperpigmentation, especially treatment-resistant hyperpigmentation, the darker and more clustered your pigmentation is, the more difficult it is to treat. So the recovery time immediately after this invasive procedure, so 3 to probably 9 months, depending on the treatment, is the most crucial time, because how you treat your skin during that time will actually show up much later of the skin. So now we're going to focus on products that actually help shorten the wound healing time, increase hydration, and reduce inflammation at the same time. Now, if you start researching post-treatment recovery creams that are specifically formulated, you're going to notice that it focuses on reducing tool. Now, the main ingredient that they're going to be using, in addition to their anti-inflammatory ingredients, are going to be one of 2 ingredients. Typically, one is going to be petroleum, the other one is going to be silicone. So petroleum, it is inexpensive to use. 2, it's inert, so it's non-reactive. And 3, it's occlusive, right? So it keeps the moisture in on the skin. The disadvantage to that is it keeps heat in. So if your skin is inflamed, that is not something that you want to use. It doesn't let the skin breathe. And if you have open wounds on your skin, right, from microneedling or acid peels or something like that, it typically doesn't work well with that, and I'm not really sure if that's something that you want on your skin. 2 is silicone. So silicone has many, many different names. The more common ones are going to be dimethicone, trimethicone, vinyl dimethicone, cyclopentasiloxane, and the reason why this is popular is because the texture is much more pleasant than petroleum. You know, it's not as sticky or gooey. It spreads more evenly. Now, here's a benefit for that, is when you put it on, it has a velvety texture. It keeps the moisture in, but it lets the skin breathe. Now, the downside to this is that if you have open wounds, or you want to limit yourself to silicones, especially you don't want it getting it into the bloodstream. You have an overactive immune system. It can be potentially an endocrine disruptor. These are some concerns. So what I tend to do is veer my clients more towards the natural, and why I promote this, and you can find something similar, I'm sure, but because I've had so many years of experience with this product, ranging from sensitive acne skin all the way to sensitive postmenopausal skin. And that's the post-treatment hydrating gel, if you can see that here, and I'll put the link in below. This one has aloe vera juice. So aloe vera juice, why I love this is because it is compatible to other anti-inflammatory ingredients. It's natural, so the natural occurring polysaccharides act as a natural humectant. The pH of aloe vera juice is slightly acidic, very similar to the skin. Obviously, the pH can range depending on the formulation of that. It's very natural, and this particular product is very compatible to other products. You can actually layer it on top with a cream. So this is why I love this, because of the extensive experience I've had with all different types of skin types. So and it cools the skin, lets the skin breathe. So it reduces inflammation, works well with other products. It's non-reactive, very similar to the skin, invites moisture to the skin all in one without having to get all different types of products.